At Sense Corp, we have 3 guiding principles: enrich and improve the lives of our employees, improve our customers' journeys, and then to make the world a better place. Being a part of this vaccine management solution truly is in our DNA. This pandemic has created an opportunity to leverage a platform for vaccine management as the first step for digital transformation for public health.
We architected a design pattern that allowed for the registration, the scheduling, the notifications, the communications, the integrations that are associated with that, as well as looking at the analytics and the reporting that go behind that. It's quick, intuitive, and easy to use.
Louvacs is a mass vaccination site in Louisville, Kentucky. We were looking for really 3 things. 1 is patient scheduling, 2, inventory management, and then 3 is documentation. Our partners at Sense Corp, in the course of 8 workdays, put together the plan and stood up processes here at Louvacs. The first week we had 1,000 patients scheduled, but after the first day it was very clear that we were going to be operating at a much higher level of efficiency than we anticipated. We're running about 200 cars an hour right now, and it doesn't look that busy.
Bringing technology to those logistics without hindering the work that needs to happen on the ground. Sense Corp is able to leverage that system and do a lift and shift as opposed to a rip and replace.
The vaccine management solution allows us to meet you where you are. So if you're having issues with the scheduling and the registration process, we have modules that do that. If you're worried about the vaccine management and the administration of the vaccines as they come in, we have a module that will work that. Depending on where you are in your process and your pain points, we have a solution to get you where you need to be quicker. The key there is the technology behind it is set up in such a way that it's very user-friendly.
It's amazing that the database system works really well. They've got it down to almost a science, and everything moves rather smoothly.
When someone is in the arena with their sleeves rolled up, only they know where the technology is getting in their way. And if we've built it in such a way that allows for the flexibility for them to change that on the fly where they need it, that's true acceleration with technology.
And we've implemented this in Austin, we're implementing this in San Antonio. We learned things in Austin that we brought to Louisville. We learned things in Louisville that we took to San Antonio. The design pattern continues to get better and better as we go forward.
We're excited that someday when this is behind us, that we hope to be able to pivot that product and be able to use it in some of our other clinical endeavors as well.
More than anything else, it's really about creating a system that is flexible enough in a modernized approach that it will replace these systems that we've had for 10 or 15, 20 years that need to be replaced.
Being in this arena, there's a buzz that's here. Your volunteers are happy to give back to their communities. Your citizens are excited that their community supported them. We can't wait to see it across the nation.